Hi everyone, I'm Dr. Jennifer Kaster, and I wanted to chat with you today about something I'm seeing a lot in my practice recently. So I've had a number of patients come in the door with complaints of feeling heartburn or acid reflux, or even a lot of bloating and gas happening for them throughout the day. And I focus a lot of my practice on helping people with digestive concerns, and so I do hear these complaints come up quite frequently. But it seems that in the last few weeks, the most common thing I'm hearing from people is that they're experiencing that indigestion and that reflux and uncomfortable feeling after they're eating. So I wanted to share with you today some information about that. When we have that reflux, a lot of times our first thought is, I have too much stomach acid. And in reality, that's not actually the case in most situations. A lot of times we actually don't have enough stomach acid when we're feeling that reflux occur. And this is causing that symptom to happen because when we don't have enough stomach acid, the sphincter at the top of our stomach isn't getting the information to close up. So when our food is churning around, that sphincter is remaining open, and that's when we get acid sneaking its way up into our esophagus and causing that irritation and discomfort that we feel. So to figure out if we have too much stomach acid or maybe not enough, there's a simple at-home test that I get my patients to do, and it's called the burp test. So it's quite interesting, and I even encourage people to do it with other family members to see who burps the quickest after drinking down a specific concoction that I outline for them to take. So that's our first step whenever someone has this symptom, is we do this burp test at home to see, okay, do we in fact have too much stomach acid, or is it too little stomach acid that we're dealing with that's causing this irritation? And that can also be the cause of bloating and gas happening, because the stomach is our first area of digestion, the first area where our food is starting to be broken down, right? So if that isn't happening properly in that organ, and the food is traveling on to the small intestine, now it's not in the right format for that small intestine to deal with. And so that's when we get bloating and gas happening, when that small intestine is trying to deal with food in larger chunks than it should be. So when we focus in and help out that stomach, it helps everything work better down the line as well. So once we know if we have too much stomach acid or too little stomach acid, there's many things that we can implement into our routine to help rebalance that stomach acid level. And we always want to look at supporting that stomach with some alkalizing agents, which sounds weird, but those components in the alkalizing supplement actually provides the stomach with the raw material that it needs to be able to bind with the hydrogen and create the proper amount of HCl in the stomach. And then we also want to pair that with some bitter herbs, which are ones that help the stomach to produce the proper amount of acid. And if the situation is to a severe level, then we also want to look at providing some soothing and coating agents to help heal up the mucous membrane of that stomach, so we don't have any pain or irritation when we're eating in that area. So just some thoughts and some ideas on stomach acid and on reflux. If this is something that you experience in your life, maybe it's daily, maybe it's a couple times a month, I'd love to chat with you. I'd love to help you out with that. There's many things as a naturopathic doctor that I can do to help that digestive system work better, help you feel better, and help you access and benefit more from all the nutrients in the foods that you're consuming. So that's all I have for you today. I hope you're having a good one. Take care.